Hey Facebook world, this is Dr. Crawford at Body Balance Physical Therapy. So this morning we're going to do a quick recap. We had a workshop on Monday and it went over vertigo and dizziness. We went over kind of what vertigo feels like, right? The spins over time. It can cause sensations of just general unsteadiness, so food for thought if that resonates with you. We also went into how our inner ear as well as our eyes have to work together in order for us to feel stable and steady. So we learned on Monday that is called our vestibular ocular reflex. When we have dizziness or some type of unsteadiness symptom that comes on when we move our eyes side to side, then that can indicate that we may have some sort of dysfunction there. I do want to put out my little, my promo on this one. There's a lot of things that we kind of consider somewhat malicious that could be causing some of these issues. So if this is something that you're dealing with, I would recommend coming in and seeing me or checking in with your primary care and then coming to see a vestibular specialist. So if this is a thing, I'm going to give you something to check on, see if this causes symptoms, and then if you do have this, then I would like you to reach out to somebody, okay? Maybe try this for a little bit. If it doesn't get better, then you need to make sure you're checking on it. Also, nausea, if you get double vision, anything like that one, please make sure you kind of touch base with somebody sooner than what you would normally kind of get that appointment. Okay, VOR number 1. You're going to sit up nice and tall. You're going to find something. So I have the camera in front of me as my version. You're going to put a sticky note on the wall in front of you, okay, plus or minus about 3 feet, so a little bit longer than arm's distance. You're going to keep your eyes on the sticky note, and you're going to rotate your head around the sticky note, okay? You're going to try to go somewhat quickly. If you can't maintain a focus there, it starts moving, it's kind of jumpy, maybe it even causes some sort of symptoms, so that's just kind of weird, unsteady, not super great sensation, and that means that we need to make sure that our eyes and our inner ear are working together a little bit better, okay? Good dosage for this is doing this for a minute to where you're having to really kind of focus on it. We call it somewhat of a retinal slip, so it's a little bit challenging to keep the focus on the sticky note. You can do this side to side, you can do this up and down, and then you can do it diagonals also, okay? So again, this is a vestibular ocular reflex exercise. This is not for if you have vertigo, okay? Vertigo is a different version of inner ear dysfunction. So if you do this, you're not going to fix your vertigo, just for food for thought. This is more specifically on making sure that your inner ear and your eyes are working together so that we can create a clear picture as we're walking and moving, okay? Another version of this, which is, again, second version of an exercise, you're going to put 2 sticky notes about 1 meter apart, okay, on the wall in front of you, and you're going to flick your eyes back and forth between them. Same kind of thing. You're trying to go pretty fast with this one, so eyes go back and forth, and we're trying to make sure that this doesn't cause any symptoms with that as well. This is what we call Cycads, so we're moving the eyes back and forth, allowing the whatever it is that's on your sticky note, maybe it's just the sticky note, but we're working on this until it doesn't cause symptoms any longer. So 2 general exercises that we typically start with vestibular rehab when we know that we have an issue with the vestibular ocular reflex, okay? Start with these exercises in sitting, please, and then you can move up to standing. If it does cause any symptoms, I would be mindful of moving up into standing until you can do these in sitting without any issue, okay? Again, working with a vestibular rehab specialist, me, we can work on making sure that we're progressing this, right? We don't normally use this when we're sitting. We do use it when we're sitting, but that doesn't translate into walking, doing normal tasks around the house, doesn't necessarily improve your falls risk. So we have to make sure that we're putting these kind of foundational things into movements that are meaningful to you in order for us to fully rehab your vestibular system. Again, we had a workshop on Monday. for dizziness and vertigo. So if we do have any questions about that, reach out. And we will have a repeat of some of these moving forward. And then another promo, we have the holiday falls and balance workshop that we'll be doing in November. So if you have any questions, you can register for that online. We're doing it through Zoom on a Monday, and then we're going to do kind of a more exercise-based one on Wednesday. Reach out if this maybe caused any issues, if you have questions, or if you need a vestibular rehab specialist.